Hello, my name is Amy Sturkey. I'm a pediatric physical therapist with about 30 years of clinical practice. And sometimes I get questions on this channel for how do I know if I'm worried? My baby is this month age old and not doing this skill, and should I be worried or not? And there are ranges of ages. There's not a single age, but a range of ages that a child's supposed to walk or sit or pull up a stand. But actually the research says that the exact date at which you start to walk or the exact date that you start to crawl is not as important. There's a lot of variability in normal development on when those skills are attained. They differ from culture to culture and country to country. There is research by a group, a researcher called Boychuk from 2019, and he has research on when it is important to get a prompt referral for diagnosis. One of them is a child demonstrates a hand preference before 12 months of age. I'm not sure that Sebastian would have had a hand preference because he doesn't use either hand well. Another one is the child demonstrates stiffness or tightness in the legs between 6 to 12 months of age. So, for example, they're unable to bring their toes to their mouth when having their diaper or nappy changed. I would expect Sebastian had trouble with this one. The next one is the child keeps their hands fisted or closely clenched after the age of 4 months of age. Sebastian would have had this. The child demonstrates a persistent head lag beyond 4 months of age. Again, Sebastian would have had this, and it would have indicated a prompt referral to a doctor, and physical therapy would be recommended. The child cannot sit without support by 9 months of age. Again, this is a red flag that you need to go have your child looked at and start physical therapy. Your child demonstrates consistent asymmetry or posture of movements after the age of 4 months. So if you see they have a strong preference to one side when they sit, or they only put weight on one side of their body, or they only move well one side of their body, then that's definitely a red flag. Other warning signs that make you need to consider a referral for a diagnosis is the child has a persistent startle or moro reflex beyond the age of 6 months, or if the child demonstrates consistent toe walking or any other asymmetry or not being the same on both sides beyond 12 months of age. If any of those things happen, then you need to start being concerned and start looking for a physician or a physical therapist or both to look for a diagnosis. I hope this is helpful for people. I do get a lot of these questions to help people decide whether they should be worried or not, and whether they should look to a physician and then possibly a neurologist to see if what is going on with their child and what next steps need to be done. I hope this was helpful, and I'll look forward to seeing you next time. Thanks. Bye-bye.